So let's talk about what a cervical adjustment is. So the cervical spine is your neck, okay? And there are 7 vertebrae in the cervical spine. So the top one here is what we call the atlas, or C1, and it's right here. As you can see, if this was a cutout of the base of the skull, C1 is right here at the top. And then there's number 2, 3, 4, 5, 6, and number 7. And so what an adjustment is as we assess the spine, we're looking for areas that might be rotated from one side to the other. We might be looking to see if the spine has some kind of a curvature in it. And then we're going to go to these areas and we're basically going to take the pressure off by adjusting the spine. How we adjust the spine, there's many different ways chiropractors adjust. There's manual techniques, there's instrument techniques. But the bottom line is what we're doing is we are realigning the misalignment and we're taking the pressure off the nervous system. So in this case, if we're speaking manually, we're going to get in here with our hands and we're going to go ahead and put a quick but very low force directed into the spine at the proper line of drive so that we are correcting the misalignment and restoring the normal position and taking the pressure off the nervous system.